Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Welcome to today's webinar sponsored by the Association of Schools and Programs of Public Health, or ASPPH. I am Monica Stadler, Director of Graduate Training Programs here at ASPPH. The purpose of today's webinar is to share information about fellowship and internship opportunities sponsored by ASPPH for students and alumni of our member CEPH-accredited schools and programs of public health. During today's webinar, we will share information about fellowship opportunities at two federal agencies, the CDC and NHTSA, and at an independent private foundation, the Beaumont Foundation, and through our partners at CSTE. We will also share information about the internship program offered at ASPPH headquarters here in Washington, D.C. during the summer. Then, we plan to provide an overview of the application process. We have allocated time at the end of the program for questions and answers. In addition, we are joined today by three of our current fellows who we have asked to share their personal experiences in the fellowship positions. First, Andrew Fisher, a fellow assigned to the Centers for Disease Control and Prevention in Atlanta, Georgia, and also Melissa Daly and Leah Reish, two fellows assigned here in Washington at the National Highway Traffic Safety Administration, or NHTSA. Also presenting today will be my colleague, Dorothy Biberman, Program Manager of ASPPH Fellowship Programs. Before we start, a few housekeeping details. At any time during the webinar, you can type your question into the questions box, which you can find on the toolbar on the right side of your computer screen, as shown here. We will address all questions during the question and answer session after the presentation. If you have not already done so, please put your phones on mute to eliminate background noises. Now to begin. The Association of Schools and Programs of Public Health, known as ASPPH, is the voice of accredited public health education. We represent schools and programs accredited by the Council on Education for Public Health, or as commonly referenced, CEPH, or CEPH. ASPPH is pleased to partner with several federal agencies, including the EPA, the U.S. Department of Transportation National Highway Traffic Safety Administration, or NHTSA, and the CDC, as well as the philanthropic organization, the Beaumont Foundation, to offer public health training opportunities for students and recent graduates of our member schools and programs. You may ask yourself what distinguishes ASPPH training opportunities from all other fellowships out there. First and foremost, with over 30 years of training program experience, ASPPH provides highly respected and recognized mentor training programs specifically aimed at fostering the growth of early career public health professionals. We have time-tested relationships with federal agencies that are involved in public health, such as CDC, EPA, and NHTSA. The performance of our fellows speaks for itself, as many of our program participants go on to become full-time employees or contractors at their host agencies. In addition, as an ASPPH fellow or intern, you become part of a network of over 2,200 ASPPH fellowship and internship alumni who are public health leaders in private, nonprofit, academic, and government organizations. Wherever you are in your career, you can always contact ASPPH and ASPPH fellow and intern alumni for networking, advice, and support. ASPPH offers two types of training programs, internships and fellowships. Internships are short-term training assignments, usually 10 to 12 weeks, and are open to students currently enrolled in an ASPPH member CEPH-accredited school or program of public health. Fellowships are long-term training assignments, typically 1 to 2 years, and in some circumstances 3 years. Fellowships are open to recent graduates, defined as students who will have received a master's or doctorate degree by the start of the fellowship, or students who have graduated within the previous 5 years of the start date of the fellowship. During this presentation, we will focus on fellowship opportunities that are scheduled to begin in summer and early fall of 2018 and internship positions for summer 2018. For the internship program, applicants must be enrolled in an ASPPH-member CEPH-accredited graduate school or program of public health and currently seeking a master's or doctoral degree. To be eligible for ASPPH fellowship programs, applicants must have received a master's or doctorate degree from an ASPPH-member CEPH-accredited school or program of public health. The graduate degree must have been earned prior to the beginning of the fellowship and no earlier than the previous 5 years. We are often asked if you must have an MPH degree specifically, or if it is okay to have an MSPH or MHS. The answer depends on where you got your degree. If you attended an ASPPH member school of public health, then any degree received through the School of Public Health is acceptable. If you attended an ASPPH member program of public health, only those degrees which are accredited by CEPH are eligible, and this varies by program. The same principle applies to doctoral degrees. They must be from the ASPPH member CEPH accredited school or program of public health. All applicants for ASPPH fellowships and internships must also be U.S. citizens or hold visas permitting permanent residence in the U.S., i.e. have a green card to be eligible. For international students who are on today's webcast, we encourage you to check with your school's Career Services Office as well as the ASPPH website, www.publichealthjobs.org, to find opportunities for which you might be eligible. You may also research opportunities available directly through the federal agency in which you are interested. Internship assignments are 10 to 12 weeks, typically scheduled June through August. Interns do receive a training stipend. Each intern is required to establish goals and objectives for the assignment period. These goals and objectives are established in collaboration with the ASPPH mentor and possibly with a faculty advisor. At the end of the assignment, each intern is required to submit a final summary report of their internship project work here at ASPPH. Now, oftentimes, the ASPPH internship will also serve to meet a practicum or internship requirement at your school or program of public health, and also can serve as the basis for a thesis or other academic paper. All internship opportunities will be based here at ASPPH headquarters in Washington, D.C. Fellowship assignments are 12-month placements. Some ASPPH programs offer extensions for up to 3 years based on the availability of funding at the host agency and the satisfactory performance of the fellow. Fellows receive a competitive training stipend, an allowance for health insurance premiums, and in some cases, a travel and training allowance. The stipend and allowances will vary by program and fellowship location. All fellows are required to establish goals and objectives that they will accomplish during their placement. These goals and objectives are established in collaboration with host agency mentors and are reported to ASPPH at the beginning of the fellowship. Fellows then report to ASPPH and their mentors on their progress in accomplishing their plan throughout the assignment period. At the end of the assignment, each fellow is required to submit a final report and assessment. Specific fellowship opportunities will be discussed in just a moment. But for now, the best person to describe a program is somebody who is in it. As such, we are pleased that Andrew Fisher can be with us today. Andrew is an ASPPH CDC Public Health Fellow based at CDC headquarters in Atlanta. Andrew is currently in the second year of his fellowship experience in the Center for Surveillance, Epidemiology, and Laboratory Services. Andrew?
Thank you, Monica. So hello, everyone. My name is Andrew. I am a second-year ASPPH Fellow at CDC. I graduated from the University of Miami, so shout out to anyone out there calling in from Miami. So I'm going to start with a brief intro to my role at CDC, and then I'll speak a little bit about my experience and the benefits I've had as part of my fellowship experience. So I'm going to start with a very bold statement. I'll begin by saying that this fellowship was the best that happened to me early in my career. I work out of CDC headquarters in Atlanta, supporting CDC's epidemiology workforce. In this role, I am the coordinator for different programs within CDC's epidemiology workforce branch. My team here is responsible for coordinating several initiatives surrounding building a stronger epidemiology workforce. The programs that I coordinate include the Science Ambassador Fellowship, which supports bringing public health curriculum into middle and high schools, and the CDC Medical and Veterinary Student Programs, which are programs that bring fourth-year medical and veterinary students to CDC for an elective rotation. In addition, I support the EIS program, which is the Epidemic Intelligence Service, and this program is CDC's flagship program that trains disease detectives that respond to different outbreak investigations around the US and internationally. So I'm going to speak a little bit now to the benefits and opportunities I've had during my experience. So as a fellow, you will have a lot of opportunities to learn and to build your skill set. I've had the opportunity to attend seminars, take professional development courses. I've also traveled quite extensively for conferences. So some examples of this is I attend a weekly seminar with the Epidemic Intelligence Service officers. So this morning, actually, I attended a presentation on an anthrax outbreak in hippopotamus in Namibia, as well as an evaluation of flagging deaths during a tornado response in Oklahoma. I've also been able to travel to conferences all over the US in Florida, Ohio, Colorado, California, and Alaska. And those are just to name a few. I've also been able to enroll in a graduate program and take courses at Stanford Business School, and this was to help through the funds that the ASPPH Fellowship sometimes offers fellows. I will mention that funding for conferences as well as some of the trainings is heavily dependent on your position and your mentors. I'm lucky that I receive a good amount of funding because my mentors are major advocates of professional development, as well as the programs that I coordinate depend a lot on travel. This is not necessarily the case for all fellows. It just kind of depends on your position. It is a fixed amount the first year, but it's negotiable sometimes the second and third year of your fellowship. So one of the great aspects of the program is having mentors. There are many different benefits, of course, of having mentors. My mentors are really awesome. I go to them for career advice, or if I have any questions related to CDC, or even just about life. I have lunch with my mentors actually twice a week. In addition to great mentors, you also get to capitalize on a professional network among your ASPPH cohort. So I came in a couple of years ago, and there's about a dozen or so fellows, and we quickly became friends because we're all coming from different institutions around the United States, and I moved to Atlanta, and I really didn't know anyone. So I immediately had a group of best friends that not only did we share passion in public health, but we got to hang out outside of work as well. So I know that I only had a few minutes, so since I'm running out of time, I'm just going to end by saying that the fellowship has really expanded my perspective. It's helped me build a new skill set and really introduced me to a wide range of inspiring people. So again, this has really been one of the best things to happen to me early in my career.
Unmuted.
To share more info, as well as connect with you guys during the Q&A section. So thank you, Monica.
Thank you, Andrew. And one thing that he didn't mention that I'd like to add is one of Andrew's mentors is an ASPPH fellow alum. So that's kind of a great opportunity that he has, that he continues to work, whether he's working with other ASPPH fellows who have continued to establish themselves at their host agency. So thanks, Andrew. We appreciate your sharing your own experience as an ASPPH fellow. Now we're going to discuss each of the ASPPH programs that had training opportunities available in 2018. We're very excited to announce 3 opportunities this year: the ASPPH CDC Public Health Fellowship Program, the ASPPH NHTSA Public Health Fellowship Program, and the ASPPH Public Health Philanthropy Fellowship Program, for those interested in pursuing a fellowship at either a federal agency and/or a philanthropic foundation. The application for the ASPPH CDC Public Health Fellowship Program is currently open, and the deadline is February 2nd. The application for the ASPPH NHTSA Public Health Fellowship Program is also currently open, and the deadline is February 9th. The application for the ASPPH Public Health Philanthropy Fellowship Program opens on January 19th, and the deadline will be March 16th. Please note that these deadlines apply to all fellowship materials, so letters of recommendation and faculty advisor verification are also due on these dates. We will discuss these more in a few minutes. The goal of the ASPPH CDC Public Health Fellowship Program is to identify new approaches and opportunities for field experience in which recent graduates and early career professionals with graduate degrees can practice applying skills and knowledge learned in the classroom and field. The program provides fellows the opportunity to train under nationally recognized experts who work to protect human health at the national and international level. Fellowship locations are in Atlanta, Georgia, Morgantown, West Virginia, and Washington, D.C. Fellowships are expected to start in July 2018. The ASPPH NHTSA Public Health Fellowship Program provides opportunities for early career professionals to apply their public health knowledge on projects that address the preventable public health problems associated with motor vehicle injuries, death and disabilities, and ultimately improve traffic safety. Fellows have the opportunity to work with experienced professionals in NHTSA to learn all components of the comprehensive approach to traffic safety, develop a thorough understanding of the shared missions between public health, traffic safety, and injury prevention, and experience working within a federal agency on projects affecting the public health of the entire nation. Fellowships are located in Washington, D.C., and are expected to start in late August or early September 2018. The ASPPH Public Health Philanthropy Fellowship Program provides an opportunity for early career public health professionals to develop skills in practice-based research, policy, and grant-making within an organization dedicated to philanthropy with a focus on public health. The fellowship is based at the Beaumont Foundation's headquarters in Bethesda, Maryland, and is expected to start in July 2018. The application for the ASPPH Summer Internship Program will open this week on December 15th, and the deadline will be Tuesday, March 13th. ASPPH Summer Internships are designed to provide a learning experience in public health for current graduate students. ASPPH interns have contributed to education, communication, and data analysis projects here at ASPPH. Finally, ASPPH is pleased to partner with the Council for State and Territorial Epidemiologists, CSTE, to promote the CSTE CDC ASPPH Applied Epidemiology Fellowship Program, which is available to students and recent graduates of ASPPH-member schools and programs of public health. The program places fellows for 2 years of on-the-job training at a state or local health agency under the guidance of an experienced mentor to train in the field of epidemiology. This application is currently open, and the deadline is January 12th. For additional information and application instructions, please go directly to the CSTE website at cste.org. Please note, this program is not administered by ASPPH, and the application process is separate from ASPPH Fellowships. The application for this program may be accessed from the CSTE website and is not part of the ASPPH online application system. Information regarding ASPPH Fellowships and Internships is available through your Career Services and/or your Student Liaison Office at your school or program of public health. In addition, you may also easily access information online, including all application deadlines and detailed applications instructions. Just go to the main page of the ASPPH website and click on the link for Study at the top of the page, and then click Fellowships and Internships. You can also go directly to the Fellowships and Internships Applications portal, where you can create an account and submit an application. A great way to stay up to date with training opportunities is to subscribe to the ASPPH Friday letter. We announce all our fellowship and internship openings through the Friday letter and advertise partner opportunities as well. Now, I will hand this over to my colleague, Dorothy Biberman, Fellowship Program Manager, to talk about the application process. Dorothy?
Thank you, Monica. To apply for a internship with ASPPH, applicants first need to create an account in the ASPPH application portal, if you don't already have one. We're going to focus here on how to apply for fellowships, but the process is the same for applying to internships, and the requirements are very similar. For those of you who already have an account in our system, you can also sign on from this page. To begin, there are 5 main components of the application package. Your resume, which is going to be specific to the program that you're applying to, 2 letters of recommendation, which are also going to be specific to the program being applied to, your graduate transcript from your school or program of public health. For the application, you can submit either an official or an unofficial transcript. However, if you are selected for a position, you will be required to provide an official transcript before you can begin the fellowship. You'll also need to provide a brief essay of no more than 1,500 words, which is specific to the position to which you're applying. So if you apply to only one position, you only need to submit 1 essay. But if you apply to 3 positions, which is the maximum, then you need to submit 3 essays. And finally, your faculty advisor information. This is only for applicants who have not yet graduated or whose transcript does not show the graduation date yet. An advisor will need to verify your graduation date in order to verify eligibility. Finally, if you are not a U.S. citizen, but instead a permanent resident, you will be asked to indicate that in your application. However, you will not be required to provide proof of residency status unless you're actually offered a position. Both green card holders and U.S. citizens will be required to provide proof of citizenship or residency status if they are offered a position. Now, before we show you how to actually use the ASPPH application portal, I'm really pleased to welcome Melissa Daly and Leah Reish. Melissa and Leah are both first
unmuted
with the ASPPH NHTSA Public Health Fellowship Program, and they'll share some tips on how to best submit your application package. Melissa and Leah.
Hi everyone, I'm Melissa Daly and I'm here with Leah Reish. We're both, as Dorothy mentioned, first year ASPPH NHTSA Fellows. And as Monica explained earlier, NHTSA, the National Highway Traffic Safety Administration, is an agency within the Department of Transportation with a goal of improving traffic safety through reducing motor vehicle crash related fatalities and injuries. So I'll pass it off to Leah to start with some of the tips, and then I'll fill in some areas that she doesn't say.
Hi, everyone. This is Leah Reish. Thank you, Monica, and thank you, Melissa. I first want to start off and say that I graduated from the University of Memphis, and I had a epidemiology concentration coming into this program. And like Melissa said, we're both at NHTSA. We're both in the Office of Impaired Driving and Occupant Protection, but I'm the Public Health Fellow in the Impaired Driving Division, and Melissa is the Public Health Fellow in the Occupant Protection Division. So our divisions work alongside each other a lot. My biggest tips with the application process is the fellowship portal is really useful. It's a great tool and it's easy to navigate. And also, if you end up not being able to do everything all in one sitting, you can do as much as you can and save it and come back to it later, which is really nice. The biggest thing that I would say is with the recommendation letters is to make sure you get those in as quickly as possible, because like Monica said, that once the deadline hits, that does mean that you have to have the recommendation letters in as well. And that was probably one of my biggest things is making sure that one of my individuals that did my letter received the email, and then I had to go through and redo the into another email. But it's definitely very good.
I would second that. For mine as well. I know like professors are obviously really busy. If you're having a professor or like a boss or someone do it, just make sure that like send them reminders. Like for me, I was like, oh, just so you know, like reminder, you have a week left, because they'll turn it in like the day before, which is kind of stressful. But
make sure
as long as you're make sure they receive it, and as long as you're in communication with them, it should be fine. Neither of the people who filled out mine had any complications with it. It was just a matter of them being busy and submitting it before the deadline.
Yes.
I would also say when you're thinking about writing your essay, I think for me, I focused mostly on first, like why I was interested in the fellowship position, but also how this fellowship would set me up for my career later. Like what kind of skills was I looking to gain from this fellowship that I thought could apply to my career in the future. So really pulling on those things. And then obviously, if you have any experience in that specific field, talk about that. That's important. I personally did have some experience interning in injury prevention, so I brought that in, but I know Leah didn't, and she
personally did not. I did infectious disease in school, so it was definitely a different aspect, but you can definitely tie in your skills into this fellowship opportunity.
Right. I think there's a lot of transferable skills. Like if you have any, I mean, obviously, if you've been a part of a MPH program, you definitely have skills that you gain even just from school that you can apply to anything. So really draw on those, and also like don't try to make up experiences that you don't have. Like talk about positive, strong experiences that you've had. Don't like pull on one small school project that you did when you have like this big project that you did for your internship that like you can draw skills from. That I think will make you look stronger than trying to make something bigger than it actually was. Yeah, I think those would be the main aspects. I also, when I was writing my essay, I went to like a writing lab at my school. They had like some people there. Sometimes it's in like the career center, and they'll have people just look over your essay, provide some tips. For me, that was really helpful to have someone else read through it and be like, this part seems a little bit off, or this part doesn't sound quite clear. Like you might want to think about adding this or adjusting this. So that was helpful.
Also with the essays, if you do plan on applying for more than one, I know specifically NHTSA has a couple different options within it in different divisions. I personally applied for more than one of them. So if you do that, you do have to do separate essays. Don't turn in the same essay. That would be a good pointer for that.
Mm-hmm. For sure. Yeah, definitely tailor it to the program that you're applying to. You don't want it to sound too generic, because then it loses like the passion piece behind it as well. And I know personally, I don't know if this is like a suggestion, but I was really curious about the fellowships, and I actually reached out to some current fellows and like called one of them. I asked her if I could call her, and she agreed. And so I was able to talk to her on the phone and ask her more questions about her fellowship specifically. And I talked about that in my essay as well. You know, like I reached out and talked to her and asked, you know, I was really intrigued by a project she was working on. So if you're interested, there's always that option as well. So I think that's mostly it.
All right. Well, thank you very much, ladies. Dorothy's now going to provide a walkthrough how to use the fellowships, internships application portal. Dorothy.
Thanks so much, Monica, and thanks, Melissa and Leah. Really helpful guidance, I would say, especially regarding submitting tailored essays. That's really a key component there, so thanks for hitting on that. Okay, so what we're looking at here is the login page, and you can see the website is fellowships-internships.asppph.org. And the first step in applying is to visit this website, and you can either log in if you already have an account, or you can sign up for an account directly from this page. You can also access the online application portal from the main ASPPH website by clicking on the study tab and then the fellowships and internships link, and you'll see you'll come to this page, and you just have to either click log in or create an account. So once you've logged in, you'll come to the home page for the ASPPH application portal. And this page shows any open applications at the top, including the application deadline and a link to the full program announcement. The program announcement is the most important resource you have when applying to a fellowship or internship, and I cannot stress that enough. It includes detailed information about the fellowship program, the positions that are open, eligibility requirements, review procedures and criteria, timelines, and also how to apply. So we very strongly recommend that you review the entire program announcement before starting your application. The homepage also includes some quick information and links to additional resources, including a My Status section shown here. Once you've submitted an application, you can also track the progress of your application in this section. And you'll also find at the bottom of the page a user's manual with step-by-step instructions on how to submit an application, and that is in the resources section. So you'll see here that there are 5 steps to completing and submitting your application. Step 1 is the My Profile page, where you enter your personal and contact information. Please be sure to use a permanent email address for your application, as this is the email that ASPPH will use to contact you about your application throughout the entire process. So a school email might not be the best option if you're not going to have access to that email after you graduate. Consider using a permanent address such as Gmail. Okay, step 2 is My Education, which is where you enter your degree information and upload your resume and transcript. Note that in the application system, you may upload an unofficial graduate transcript for the purpose of the application. But if you are offered and accept a position, you'll be required to provide an official graduate transcript. You can also upload a graduate transcript if you want to, but unofficial will be fine. In addition, when you enter your graduation date, if that date has not yet occurred, so if you have not yet graduated, you will be directed to enter your faculty advisor information. When you submit your application, the system will generate an email to your faculty advisor asking them to verify your expected graduation date. You should be sure to talk to your faculty advisor before the application deadline so that they are aware that you're applying to this and will be prepared to respond when they receive the email. Also, please note that the email to your faculty advisor will not be sent out until you submit your application for the first time. So it's not a good idea to submit your application for the first time on the due date. If you plan to submit your final application on the due date, you should enter your faculty advisor's information before then, submit the application in order to prompt the emails to be sent, and then click the pencil icon from your home page to continue working on your application. This is pretty much what Leah was saying earlier, that you'll be able to save and close and come back. You can also submit and then unsubmit by clicking that pencil icon so that you can make changes. But just remember to resubmit your application by the deadline or it will not be reviewed. Step 3 is My Application, and this is where you select the positions you're applying for and upload your essays. It's also where you enter the information for your references. You'll see an open list of positions for the program you're applying to on this page. And if you're not sure which positions you want to apply to, there'll be a link to the program announcement at the top of the page, which includes details about each position. And then you apply to the position you're interested in by uploading an essay to that position. You may apply to a maximum of 3 positions under each fellowship program, and the system will not allow you to upload more than 3 essays. The reference section at the bottom of the page is where you'll enter the contact information for the 2 people who've agreed to write your letters of recommendation. There's no restriction on who you may request to be your reference, but they should be people who can speak to your experience and your qualifications for the program you're applying to. When you submit your application, the system will automatically generate an email to each of your references asking them to submit their letter of recommendation. As with the faculty advisor, you should be sure to speak to your references well before the application deadline so that they're prepared to respond. Also, as with the faculty advisor section, the email to your recommenders will not be sent out until you submit your application for the first time. So once again, it is not a good idea to submit your application for the first time on the due date. If you do think that you will need to submit your final application on the due date because you're still working on essays or whatever the case may be, you should enter your recommenders information before then, as early as possible. Submit the application in order to prompt the emails to your recommenders to go out, and then go back to the home page, click the pencil icon so you can continue working on your application. And once again, please remember to resubmit by the deadline. So in step 4 of the application, you're going to review the entire application package. If you need to make any changes, click on the pencil icon to the section you want to revise, and it will take you back to that section to make any changes. And the final step is to submit your application, which is step 5. Check the box to electronically sign your application and then hit the submit button. When your application is successfully submitted, you'll receive a confirmation email. This is when the system will also automatically generate the emails to your references and faculty advisor if applicable. Please note that just saving the application with that information will not generate the emails. You do have to actually hit the submit button for this to happen. And as mentioned earlier, your faculty advisor and references must also complete their sections by the application deadline. So once again, do not wait until the last day to submit your application because your references and faculty advisor will not have time to submit their materials before the deadline. So once you've submitted your application, as we've mentioned, you may rescind it at any time to make changes from your homepage by clicking on the pencil icon. And this is the little dialog box that comes up. And as long as you resubmit by the application deadline, your application will be reviewed. As we've mentioned, this is a good option if you want your references and faculty advisor to get the emails earlier, but you're still working on perfecting your essays or working on your resume. But just remember, if you rescind, you must resubmit by the application deadline or we will not review your application. ASPPH will also not accept any incomplete applications. This includes missing information and submissions from your references or faculty advisor. The application deadline is the deadline for everything, including receiving their documents. Once the deadline has passed, ASPPH will review all of the applications for completeness and eligibility. We'll update your status in the system when your application has been verified and moved along to the review stage. You may view your application status at any time you're logged into the system, and the system will also automatically send you an email update with every change in status. Now I'm going to turn the presentation back over to Monica to go over the review process. Monica.
Okay, thanks, Dorothy. So what comes next? Once the deadline is passed, ASPPH will review all applications for completeness and eligibility. We'll update your status in the system when your application has been verified and moved along to the review stage. You may view your application status at any time you are logged into the system. The system will also automatically send you an email update and change in status. Each application is reviewed by 2 faculty or staff members from ASPPH member institutions, but not from the same institution as the applicant. Applications are scored according to criteria noted in the program announcement, and the top applicants progress to the next phase, the technical review. During this time, applicants may be contacted for interviews directly by the agency. Moving on to the technical review phase does not guarantee that an applicant will receive an interview, only that the application has been sent to the placement agency for review. It is possible that not all applicants in the technical review phase will receive interviews. Individuals selected for a position will be contacted directly by ASPPH via phone and email. Those applicants who are not selected will be notified by ASPPH by email. The timeline for each program varies, so please refer to your website and the specific program announcement to review important dates for the program in which you're interested. This ends our formal presentation. We'll now open the lines for questions. As noted earlier, please type your question into the chat or question box in the right corner of the screen. To open the box, press the 2 arrows. I'll then direct your question to one of today's speakers. We have about 15 minutes left in today's program. We'll try to answer as many questions as possible, but if we run out of time, you may email your questions to ASPPH. We will compile those questions and responses and post on the resources page of the ASPPH application portal. So to start with questions, we have a question here. And thank you for pointing this out. This is a good thing for us to know. So it notes that on our website, the Public Health Philanthropy Fellowship states that it closes on the 24th. However, as I stated earlier, it will close on March 16th. Since we haven't launched the updated application cycle, we still need to update that. But rest assured, the application deadline will be March 16th for the Philanthropy Fellowship. But thanks for pointing that out for us. There's also a question if there's an interview component to the application. For the programs that are currently accepting applications, or so any opportunities that are available in 2018, there is not an in-person component to the application process. We have had that with other of our programs, but for NHTSA, CDC, Beaumont, as well as our internship, they will all be telephone interviews, and those will happen directly with the host agency. So for example, if you make it to the technical review phase at CDC, you will get a call from somebody at CDC directly in order to set up that phone interview. And the same for applicants to NHTSA. Somebody at NHTSA will contact you directly to set up a telephone interview. Okay, another question is, are the fellowship positions offered by ASPPH the same fellowships offered by ORISE? The answer is a definitive no. ASPPH and ORISE are completely different organizations and completely different types of opportunities. So yes, absolutely distinguish those. ASPPH fellowship programs are true fellowship training programs through which you need to undergo a stringent review process, and they are open only to recent graduates of ASPPH-member CEPH-accredited schools and programs of public health. There's a question asking about the diversity among our fellows, and if there is significant diversity specifically among Black or African American women. And yes, over the history, I have been running ASPPH fellowship programs since 2002. And over the many years, I am very happy to say that there is significant diversity that is represented across the lines. Obviously, we tend to be heavy female dominant in general because I think just the field of public health tends to have lots of women in it. And then also there is strong representation by women of color, both African American and Latino women as well, I'm happy to say. So there's a question about what sorts of questions are asked during the interview process. I'm going to hand this over to our fellows. And so Leah and Melissa, and then afterward, Andrew, if you have anything to add, feel free to chime in after they speak. So Leah, Melissa, if you can think back in your memory about some of the types of questions you received during your interview process and share those with the group.
Yeah, as Monica said, you interview directly with the agency that you applied for. So my current mentor was on the interview, as well as I think there was 4 or 5 people in the room on the call. And they asked questions about my experience in different areas, things that I had mentioned in my essay, things that I might want to do there. They explained about projects that they were working on. I wouldn't say there was anything that stood out as really stumping me, I didn't know what to say. I think just be prepared to talk about your experience and your interest and kind of elaborate on your essay. But in person, I think it's just a good chance to be able to kind of show your personality and your passion for public health. And it's just a good opportunity to do that on the phone. So yeah, I didn't think the interview component was intimidating or really challenging that much. So that was good. I don't know if Leah has anything to add.
So everyone that knows me knows that I take a lot of notes, and I actually have my notes from my interview on my phone. So, sorry. I said that everyone who knows me knows that I take a lot of notes, and I actually have my notes from my interview on my phone. So I have all the questions written down, and I can give you some of them. They did ask what my expectations of the fellowship were. It was very interactive. We kind of talked about NHTSA as a whole at the beginning, and everyone introduced themselves. I introduced myself, and then they asked questions, and then it was time for me to ask some questions at the end. And the questions that they did ask, none of them, like Melissa said, none of them really stumped me. But they asked my particular interest in traffic safety, describing a role or an objective that I've had to do in the past, and I was able to talk about my thesis a lot, or if you did a master's project, you're able to talk about that. And then they asked, there were probably the hardest question I got was they asked if I had a difficult work situation in the past before, and kind of just talking about that, and how you would go about that. But typical questions, self-motivation questions, discipline questions that would be within any interview process.
Thank you. Andrew, do you have anything to add?
Yeah, I think basically what Leah and Melissa said was similar to my situation. I actually had a very unique situation in that one of the positions I applied to asked if I spoke a second language, and I did. I speak French, and so I actually had an interview in French. So that was something interesting and I think unique. Not necessarily, you don't need a second language necessarily at headquarters, but just to keep that in mind. But the questions were pretty open-ended. I think that I would suggest at least preparing for the interviews. So typically you find out a little bit about the division and the team, and so you can always do a little bit of research beforehand, and the more prepared you are for an interview, the better. But there were really no questions that had a right or wrong answer. It was pretty open-ended, so just kind of be yourself. That would be my suggestion.
All right, thank you. And also I'd like to add that this is the time to leverage the resources at your school or program of public health. They all should have a career services office, and please take advantage of what they have to offer. Most of them will have written materials, but also I know many of the career services directors that I know will provide seminars or trainings, Q&A sessions, tips for interviews, things like that. So definitely talk to your career services office and take advantage of the resources they have to offer. So we have another question, and Dorothy, I'll throw this to you. They're asking, how soon can I apply for the fellowship? They're currently a first year in their MPH program. So what would you have to say?
Thanks, Monica. So it's actually a little bit more complicated than that, which is because different programs have different lengths of time. But if we assume that the general length of time for an MPH degree is 2 years, which in general it is, you would not be applying during your first year for a fellowship. This would be the right time to apply for an internship. But for a fellowship, you have to actually have graduated before the fellowship starts. So since our fellowship programs start this coming summer and fall 2018, if you're not going to graduate in 2019, you should not be applying to a fellowship right now because you're not eligible yet. But you can apply to an internship, and next year you can come back and apply to a fellowship program for 2019. Some programs do work on a different schedule. If you're doing a part-time, it might be a longer. If you're doing a compressed schedule, it might only be 12 months. So the general rule is you have to graduate before the fellowship starts. And so that's how you should think about it in terms of when is the right time to apply.
Great, thanks, Dorothy. We also have a question that the ASPPH CDC Fellowship Program announcement states that there are currently 9 positions available. And will there be additional positions announced? That's a great question. So currently we're accepting applications for specific fellowship opportunities with the CDC. However, there is the possibility that more positions will come up over the next 2 to 3 months as folks at the federal agencies identify additional funding, and they might have, I was just on the phone yesterday with my colleagues at CDC, and we were talking about that some of the offices were very enthusiastic about bringing on a new fellow. They just simply did not have the funding identified at the deadline of when they needed to submit their fellowship descriptions. But there is a possibility that over the course of the next 2 to 3 months, as we are going through the application process, funding could be identified for new positions. So in short, your answer is yes. It is possible that additional positions could arise before the end of the placement process for the 2018 class of fellows. There's a question also about if there's a database or contact information for current or past ASPPH fellows. ASPPH makes it a practice of not providing contact information for current and former fellows due to privacy reasons. I'm actually, I was surprised when Melissa mentioned she was able to get a hold of, I don't know if it's through her school or if it was in the
through LinkedIn. Yeah.
Okay, through LinkedIn. Yeah, that's another, because we do have, but typically, if not during the application process, do we connect fellows. However, if you are extended an offer, if you are offered a position for a fellowship, before you make your decision, if you want to speak with a current fellow, at that point, we will provide you with contact information for fellows within that program. So if you are in fact offered a position, in order to make sure you have all the information in front of you in order to make the proper decision for yourself and to get all the questions answered as best as possible before you make that decision, we will put you in touch with current fellows within the program that you've been offered. And so we also have a question, are any statistics available regarding number of applications per year versus how many participants are ultimately selected? This varies greatly depending on year we have and program. We've had programs that we've had in the past that we currently aren't managing have received hundreds of applications. Some of our smaller programs will receive as few as 20 but only place one position. So and for the statistics and the data on that are all over the place. So it's really hard to say, and it really depends on the year, the program, and the number of opportunities that are available for any given year. Okay. So we could probably take one more question. So Dorothy, I'll let you take this one. It says, if an application is submitted to generate the email to references, then rescinded to be edited, will there be an issue with references submitting their letters of reference into the system?
Great, thanks Monica, and thanks for this question. It's a really good question, and the answer is there will not be any problems. Once you have submitted your application for the first time, it exists in our system. So regardless of whether you need to rescind it to keep working on it, the link that is sent to your faculty advisor or your references will still be active and still upload to that application until the deadline passes. So that's a great question. And Monica, I just want to answer one more that it says here, can an international student still go ahead and apply to a fellowship program? And I just wanted to address this one because we do not want there to be any ambiguity about eligibility. So if you are not a U.S. citizen or a permanent resident of the U.S., the system will actually notify you that you are not eligible for fellowship system. So I would not recommend starting your application, but if you do, you won't be able to get very far because we don't want you to have to put a lot of energy into something that you will not be eligible for.
Yes, thank you for taking that question. There's actually then one more last question that we'll take before we close that I think should be addressed. It asks if there's a stipend and do the positions come with health benefits? Yes, and I'm assuming this is for fellowships. There is an annual training stipend for all fellowship positions, and all fellowship positions also receive an allowance to help offset the cost of medical insurance premium. That's health insurance, which includes medical, dental, and vision premiums. So we do provide an allowance to help cover the cost of your health insurance. And then it all varies by program, the amounts, and also by program, there are other allowances that are available. This is where the program announcement comes into play. As Dorothy mentioned earlier, read the program announcement that's on the website. The program announcement has all the funding details as far as what the stipend levels are, what expense allowances are available. So if there's a health allowance, if there's a housing allowance, if there's a travel allowance, All those items are in the program announcement. So please, please take the time to read the program announcements that are available on our website. All right, so this concludes today's webinars, and I'd really like to thank all of our speakers for your participation and insights today. Thank you very much. Have a great day and happy holidays, everybody. Bye-bye.